Dr. Nina Chris William.
Good afternoon. My study is on comparing ocular surface thermography at different temperatures using intelligent dry eye analyzer. Dry eye disease is a multifactorial disease caused by the loss of homeostasis, and it's very commonly seen in our OPD practice. There are several diagnostic tests to diagnose dry eye, however, many a time they are inconclusive, which made us explore other parameters. So thermography permits an indirect evaluation of the evaporation rate using a thermographic camera which operates within the infrared range. This concept was introduced in 1968. However, there is no commercial instrument to assess thermography. So our hypothesis was the change in environmental conditions in terms of temperature and humidity can alter the ocular surface temperature and trigger pain receptors, causing dry eye symptoms. So the aim of a study was to compare the ocular surface thermographic changes with severity scores in subjects with dry eye symptoms and asymptomatic individuals at ambient room temperature and humidity and a temperature controlled and a humidity controlled environment using a novel device. So this was a cross-sectional study done at a tertiary care center. Our sample size was 24. We had included healthy individuals in the age group 18 to 60 years. Initially the subjects were asked to fill the OSTI questionnaire, and they were divided into normal and asymptomatic based on the OSTI score. Then the OSTI questionnaire can be further subdivided into the ocular symptom subscale, the vision subscale, and the environmental trigger subscale. The study setting was ambient environment condition, temperature was 25 to 27 and humidity between 70 and 75, and control temperature was 20 to 22 degrees and relative humidity between 55 and 60. So this is a novel device which is based on artificial intelligence and machine learning. So out of the several parameters it can assess, ocular thermography is one. We have a clip-on version on the slit lamp and the standalone device. So this is how the patient is analyzed on the slit lamp. This is a report generated, and you can see the last two images show the ocular surface thermographic variation, and it gives the severity scores. So the results, mean age group was 28 years, we had 7 males and 17 females. We compared the severity score at the ambient temperature and at the low temperature and humidity based on the OSTI score, and we realized that the severity score was higher at a lower temperature and humidity in both the groups. Then we compared each subscale. In the ocular symptom subscale as well as the vision subscale, we noticed that the severity scores are higher at a controlled temperature and humidity. However, those two results were not statistically significant, but in the environmental trigger subscale, we noticed that there was a drastic increase in the severity score at a controlled temperature and humidity, and it was statistically significant. So we conclude, our study showed that the ocular surface the temperature variation during the inter-blink interval was significant in those people who are symptomatic at a lower temperature and humidity. So other studies also showed that in dry eye individual there is a greater variation of the ocular surface temperature across the ocular surface compared to a normal person. And studies done by Morgan et al. Showed that the surface temperature was higher in a dry eye person compared to a normal person, and there was a greater decrease in the ocular surface temperature on prolonged eye opening. So we conclude that poor correlation signs and symptoms have called for novel technology, and recent advances in AI have overcome many pitfalls of the clinical testing, and ocular surface thermography severity scores are a novel approach to understand and diagnose dry eye disease. Thank you. These are my references.
Do you yourself took the readings of iSmart?
Sir, the machine gives the readings. We have. I did the scans.
That I can understand, yes. Because what I find in this conference only, they are exhibiting the instrument in the exhibition halls.
Okay.
Yes. So they themselves could not take readings 3 or 4 times. They tested me.
Okay. So the result comes, actually we take the scan and the result is sent to us, because there are some PhD students who are analyzing the report.
That is true, but
we don't get the result immediately. It comes in a few hours. Because it's a novel machine, so they're just getting the
Nice presentation.
Thank you.
I have two questions for you. So how did you calculate the sample size of 24?
Ma'am, this is a pilot study, so we took only the volunteers were taken for the study. So we took the initial.
So when you write sample size, there has to be a calculation, there has to be a formula
Yes.
attached it. It cannot be a pilot study. You can just put any arbitrary number and say that this is a sample size. You can just say that these many patients were included in the study. And how did you control? I could not understand the methodology. Maybe forgive me for not understanding, but how did you do the control temperature and humidity?
Yes, ma'am. No ambient temperature. We have a dehumidifier also. So patients at controlled temperature, we made them sit in the air conditioned environment for 20 minutes, and we have a dehumidifier. So when the humidity was around 50 to 60, we assessed. So after 20 minutes of sitting in that controlled environment, we assess the patient.
So it's uniform for everyone.
Yes, ma'am, for everyone.
Thank you.
Thank you.